vaccine equity affirms human rights. Vaccine nationalism denies it. Vaccines must be a global public good, accessible and affordable for all. The virus is also infecting political and civil rights and further shrinking civic space. Using the pandemic as a pretext, authorities in some countries have deployed heavy-handed security responses and emergency measures to crush dissent, criminalise basic freedoms, silence independent reporting, and curtail the activities of non-governmental organisations. Human rights defenders, journalists, lawyers, political activists, and even medical professionals are being detained, prosecuted, and subjected to intimidation and surveillance for criticising government pandemic responses, or the lack thereof.
The pandemic ripped the mask of the deadly realities of discrimination, deep inequalities, and chronic underfunding for essential services and rights, all largely ignored by many policymakers. It demonstrated how severely the neglect of human rights endangers societies. And it also showed us the profound protective value of human rights-based approaches. Today, the medical impact of the pandemic is far from over, and its effects on economies, freedoms, societies, and people have only just begun. The global rise in extreme poverty, accelerating inequalities, setbacks to women's rights and equality, to education and opportunities for children and young people, and to the Sustainable Development Agenda are shocks that could shake the foundations of societies. We must now urgently act on the clarity of 2020 vision as we face year 2 of COVID-19.
And for more on this and other developments, including in the United States, reaching the grim milestone of 500,000 COVID-19 related deaths, let's speak now to our New York-based correspondent, Sherwin Bryce-Pease. And Sherwin, as I can see right behind you, the snow is showing off on your behalf. A beautiful, beautiful view.
Yes, freezing conditions here at SABC, certainly very cold. I'm very happy to be having this conversation with you while indoors.
All right, so let's talk about human rights, COVID-19. There's no getting away from it. Now, human rights have been acutely impacted by this pandemic. What else did come out of the summit?
Yeah, you correctly point out that the pandemic was in large part very much the focus of this human rights speech delivered by the Secretary General to that Geneva audience earlier today. But the one country he did mention in that speech was the situation that is developing in Myanmar right now. Of course, you'll remember the military coup there in January. He talked about how the actions of the military were undermining democracy. He called out their actions for the brutal force that they represent. He called it repression in all its manifestations. And he said that they were all coming together in a perfect storm of upheaval. He said the military must stop their repression. Coups have no place in the modern world today. So that was specifically reference to the situation in Myanmar. But this was very much a speech looking at the human rights deficits that have been enlarged in a big way by the COVID-19 pandemic. He talked to Piso about how the vulnerable, the people at the lower rung of societies, are the ones that have been most severely impacted by the ramifications of this pandemic. He talked about the losses we've seen in terms of the women's rights agenda, how minorities, persons with disabilities, older people, refugees, migrants and indigenous people, essentially those groups of society that are struggling anyway, in the absence of a pandemic, no less when there is one as prevalent as COVID-19 has been. And he also talked about the rise of racism, xenophobia and other forms of discrimination that are also feeding into as a response to the pandemic at Zippy. So let's listen to what he had to say on that in particular.
I want to focus on two areas where the imperative for action is great and the scale of the challenge looms large. First, the blight of racism, discrimination and xenophobia. And second, the most pervasive human rights violation of all, gender inequality. These evils are fed by two of the deepest wells of injustice in our world, the legacy of centuries of colonialism and the persistence across the millennia of patriarchy. The linkages between racism and gender inequality are also unmistakable. Some of the worst impacts of both are in the overlaps and intersections of discrimination suffered by women from racial and ethnic minority groups. Stoking the fires of racism, anti-Semitism, anti-Muslim bigotry, violence against some minority Christian communities, homophobia, xenophobia and misogyny is nothing new. It has just become more overt, easier to achieve and globalized. When we allow the denigration of any of us, we set the precedent for the demonization of all of us.
Tsepiso, the Secretary-General, also welcomed what he described as the new awakening in the global fight for racial justice, I think evidenced on the streets of the United States in the aftermath of George Floyd's killing in particular. He called out the danger of hate-driven movements growing by the day. White supremacy, neo-Nazi movements, he says, have become more than just domestic threats. They've become transnational domestic threats. So these are elements that are now not just found within countries, but certainly now have the ability to cross borders, Tsepiso.
Now, in other news, Sherwin, a very sad milestone for the United States, reaching over 500,000 deaths from COVID-19. And I believe there was a candlelit ceremony at the White House. Tell us a little bit more about this.
Well, that's in the planning. We understand that there will be a candlelit ceremony later today. You know, the snow notwithstanding, President Joe Biden has really demonstrated a more empathetic posture to the level of death and suffering we've experienced here in the United States. We are, though, seeing improvements in the number of hospitalizations. Those are down, Tsepiso. The number of daily infections are down. But the clip at which people are dying in the United States on a daily basis is still very much above average. You know, the United States has over 500,000 deaths. The closest other country is Brazil at around 246,000. And that just talks about the huge disparity we've seen in deaths, in particular in the United States. On Sunday, 1,200 deaths. On Saturday, over 2,000. Friday, 2,477. Thursday, 2,616. So that really is a benchmark, a barometer that still needs to come down. And I think we'll hear some of those mitigation efforts at that candlelit vigil that will be led by the President later today. Earlier today, Dr. Nancy Massonia is the director of the U.S. National Center for Immunization and Respiratory Disease. She was speaking at a WHO press conference and raised the issue of 500,000 deaths. Let's watch.
It's remarkable that a year ago in the United States there were 14 COVID-19 cases, and as of today we've had more than 500,000 deaths. Even though we've started to see decrease in cases and deaths here in the U.S. and in many areas of the world, the COVID pandemic is clearly not at an end. We still have a long way to go. Thankfully, as soon as the viruses that caused COVID-19 was discovered, scientists around the world began working on vaccines to protect us. The use of a safe and effective vaccine worldwide will be a game changer as we work together to beat the pandemic.
Vaccinations, of course, now at Tsepiso reaching around 13% of a population of around 330 million. So 13% of the U.S. population has now been vaccinated. But according to the scientists, to get to herd immunity, you want to get to the 60, 65, 70% level. So a long way still to go here.
Now, Sherwin, as we see a rise in vaccine nationalism, the inequity that's come to define the distribution and access to COVID-19 vaccines globally. There's been a message from Dr. Anthony Fauci about what countries like South Africa need to do to take a strong look at building capacity to deal with future pandemics.
It was a question he was responding to posed by the SABC's foreign editor, Sophie Mokoena, asking what role countries like the United States, developed countries in particular, can play in supporting countries like South Africa, developing countries where there is the kind of vaccine deficit that they are experiencing right now. This is how Dr. Fauci responded to that question. Watch.
the best way to have sustainable capability of being able to respond to outbreaks, not only the outbreak of COVID-19, but also the inevitable outbreaks that will also occur in the future, is to build capacity within country, that's sustainable capacity. So one of the things that developed nations need to pay attention to is that in addition, in the immediate sense, which you don't have the time right now to have something built in a week or two, but to think for the future as well as in the intermediate time, to have countries like South Africa and other Southern African countries to have the capability to make their own vaccine so that they would be independent of having to rely on the donation of vaccines from other countries. And I think it goes not only for South Africa, but so many other countries that, if given the resources and the capabilities, would really be quite capable of making vaccine to take care of their own population.
Yeah, comments that very much add to the United Nations narrative, Tshepiso, about how we build back better, the focus on universal healthcare. How do we shore up our public health systems to deal with calamity scenarios like COVID-19? In addition to that, is really to plan for better mitigation efforts in country as it relates to pandemics. And one of those mitigation efforts is the ability to develop and to procure vaccines in-house rather than waiting on timelines where competition between developed, richer and poorer countries seems to leave poorer countries with a deficit right now.
All right, thanks a lot, Sherwin Bryce-Pease, my colleague who is in New York. Now, the